Hi everyone, this is Dr. Baz. This is another episode of my podcast. My lovely and amazing patient Nina is here. Just 1 year follow-up, and also she wants to share her endometriosis and also the fibroid journey with us. Nina, welcome to podcast.
Thank you. It's a pleasure. Thank you for having me.
Thank you very much, Nina. So I would like to start the conversation that you came to my office 1 year ago.
Correct.
And then before that, I think you saw so many multiple gynecologists
Correct.
with the different problems.
Yes.
Just can you describe me or walk through about that? What was the symptoms that then push you through to come to my office?
So I started my menstrual at around 11, and I don't really remember a time where I didn't have complicated, menstrual cycle, extremely heavy bleeding, constant pain, back pain. Especially around that time of the month, I would have, if I ate anything spicy or anything, I would have lots of inflammation and just really excruciating pain. In my country, in the UK, they just told me, oh, it's just normal. Everybody has different periods. They're not all the same. Some more severe than others. And then I moved to the US. I had my son, and after that, my periods became a lot worse.
Worse, yeah.
And I was diagnosed with endometriosis scar or something. And they said to me, it's different from endometriosis. It's just a one-time thing.
Yes.
It's just from the C-section.
C-section, yes.
And so I had the surgery for that. I was fine for about a year. And then about a year or two later, the same thing. The constant pain, the bleeding came back. And for years, I had severe bleeding.
So you deal these things all the time?
Yeah, it was constant.
Constant bleeding and constant pain.
Basically, my whole life was managed around my menstrual cycle. Yeah. So vacations, trips, even going to like the movie theater, just really basic things. Everything had to be planned around.
Yes, planned around with your cycle, basically.
My
right?
cycle, yeah. Correct, yes. And then, so about a year before I came to you, I had just really deteriorated. My periods were just really bad, and I became severely anemic. Okay. Iron infusions, they just weren't working because I would have the iron, and then I would just continue to bleed.
I remember that, your iron, like your blood work, basically, your hemoglobin, like a 6, 7, very low number.
Extremely low.
And you're walking with like a very low iron level.
Yes. And it was my endocrinologist that said something is wrong. Yeah. So I went to go see a gynecologist.
Before me?
Yes, before you. Another one. I had consulted many. And again, they told me there isn't anything. I'd had ultrasound. They didn't see anything. And she checked me. I had another ultrasound and she found a fibroid. Yeah. I felt like it wasn't just a fibroid, that there was something else. So I asked her if she could do the laparoscopy just to check. And I had the surgery. She did that and she said,
too complicated.
It's too complicated.
Yes,
so the fibroid was left.
Yes.
Endometriosis was left. Yeah. She said that's when she saw your organs are stuck together. Your bowels, your uterus. There's so much going on. You just need to take it out. Take it out.
Take the uterus out.
Take that uterus out.
All right. So can I just briefly interrupt it? So this is like she diagnosed with stage 4 endometriosis. Number one, that she referred you to me, really appreciated. Other doctors are basically referring to me, and she knows that this is like a very difficult situation.
Correct.
And then all the organs stuck together, calling the frozen pelvis, which I will already made the diagnosis when I'm doing the robotic surgery for you.
Yes.
And then the fibroid is already the quick brief that the fibroid is not a location that easy to take it out. The reason why you have basically two main problems. Number one is a fibroid. Number two is a stage 4 endometriosis.
Yeah.
And then she was so, understanding. She didn't understand too much about this endometriosis at that moment. She understood that it's a very complicated and difficult surgery, and it's better off to get an endometriosis specialist just deal with you and then just try to able to remove all the disease from you.
Yes.
When you came to my office, I remember like yesterday, like a year ago, you are so much different situation. When I'm looking right now, like a day and night.
Yes.
Yes,
Definitely.
you weren't smiling at that time. Your
Yeah.
hemoglobin low, your
Yes.
excruciating pain.
Yeah.
And then this pain is always bothering me because the whole way about this podcast that I want to inform and raise the awareness about the endometriosis pain.
Yes. The
So
constant
then
inflammation.
we discuss about these things, but we schedule the surgery. But I will give a little bit quick story about that. Then 2 weeks later, we scheduled surgery. But a week later, on the Sunday night, I got a message from you that you were in the different hospital for bleeding, right?
Yes.
So what happened? Just give me a quick story. Share the story with us.
Yes. So
Before the surgery, like a week ago,
while
Sunday
waiting
night.
for the surgery, you had sent me to have like an MRI
Yes.
and a blood test. I had a period that was terrible. I was just bleeding through, and I said to you, like, I just don't feel good. You sent me to have blood work, and you text me or you called me, I think.
Yes. The blood
Sunday
works are very low.
saying,
Yeah.
You need to get to the hospital. It was like a 5 or 6.
Yes. Though very low, like a 5.4, very low that you can't get the surgery, like a very low.
Yeah, because I couldn't even walk at this
yes.
point. I was really severely out of breath. And so, I went to the emergency room, and they also did, some tests, like the ultrasound, found like the fibroid
inside your uterine cavity that's causing all the bleeding. Basically.
Yes. And then you was calling me in between. And
Sunday, all day Sunday.
Yeah, and I was just so distraught. And
then let me tell you that you were so anxious.
Yes.
You were so anxious with your family. You were there.
Yes.
You know what? It's better off to come and see you. Sunday nights around 8 p.m. that, I drove from my home to your hospital, to the hospital. They are just watching you over there.
Yes.
And then we talk each other. And then, I see you that, this is the time, Nina, just get it over. Then I look at all the reports, still a little bit low. And then you got some blood transfusion there because of the reason why you went there anyway. So Sunday night they're done. And then Friday we did surgery.
Yes.
And then surgery is basically, as far the other year, the doctor told us that it's definitely a stage 4 endometriosis. It took me like a 3.5 hour surgery, remove all the disease, and then also remove the fibroids.
Yes.
And guess what? 1 year later, you are doing the podcast with me.
Yes.
So walk through with me that and all the audience, the listeners. So how you feel right now? What things are changed after the surgery? How is your life right now with your family, with your personal life, your anemia, basically?
Night and day. I had anemia since I was 11 because of this issue. And, even in the hospital, when I was at the hospital, when you came to see me that night, you drove all the way down to see me that night. And I had seen doctors in the hospital, and they told me, you just have to take the uterus out. You have to take the uterus out. And you were the only doctor that had ever asked me, do you want to have more children? Every doctor just kind of there's nothing you can do. You just have to, take it out. So, even with months of having the surgery, like my menstrual cycle went down to like 4 days, 4 days, maybe 2 days of, of bleeding. And then it's just, spotting, and it's completely changed my life because I have freedom. I'm able to travel more easily. I'm able to do things. I don't have that,
Before then.
Yeah, I don't have, the pain that was so intense, the inflammation that, had me.
The pain is also gone, right? Just the excruciating pain, not just on the bleeding, all the pain.
Exactly. And I'm like, oh, this is what it's, I even, ask my friends, this is what it's like to have like a normal period in life. They're like, yes.
This is the basic, you normalize the pain that you suffering for almost how many years, since you are 11, the first menstrual period, and then you think that it's normal.
Yes,
but
you think it's
until
normal.
you got the treatment that remove the disease and then remove the fibroid, and this is the life that everybody's living, and then you basically suffer that not to live this life.
Yes.
So thank God, and then you came to me.
Yes.
I helped you out. Really appreciated that you and humble that you trust me.
Yes.
I'm very happy that the reason why you're on the podcast, that I'm very, very happy. This is like my passion.
Yes.
Helping one patient at a time. that this is not normal.
Yes.
But you're describing me, you're suffering all the years. It wasn't normal.
Exactly. And I think also, your compassion made such a, big difference in my situation.
Yes.
Because, like I said, for years, I was just dismissed that, this is just normal. Some women just have periods like this and you just don't feel heard. And when I met you, I finally felt validated.
Just the first day, basically, right?
Yes.
When you talked to me first day.
Yeah. Actually, when I called to book the appointment and, your secretary said to come in, the next day, I called in tears because I had, received, like the news that you have endometriosis, like this is like really bad. And when I called your office, I called crying and, your secretary said, come like the next day.
Yes.
And
probably for the day that when you called, but I was in the surgery. I'm sorry about that. But the next day I saw you.
Yeah.
And then I understand that you brought some pictures. You know what?
Yes. And
from my bottom of my heart,
yes.
The moment that I met you with you, your husband, I said that, you know what, you need my help.
Yes, exactly.
And then let's walk through together. Let's beat the disease together. Let's fight against endometriosis together and fibroids.
Yes.
And then this is the reason why you are here today.
Yes.
I'm telling you, I'm very happy. I'm very confident that I change your life.
Yes,
and it will like that forever.
Yes, and I thank God for leading me to you and even learning that there is a solution. I don't know if many people are even aware. There's so much misinformation about endometriosis. And a lot of doctors really don't fully understand the disease. Even the experts don't fully understand the disease, and so there are many women that feel like this is just the life that they that they've given, they have to deal with. But thank God,
My pleasure. My pleasure. So, anything else to share our audience? Anything else?
To just continue to seek help. You don't have to suffer in silence. It's not normal to have consistent, excruciating pain. It's not normal. It indicates that there is a problem. So to seek out, an expert in pelvic disease, to get to the bottom of it.
Bottom of root causes of the disease.
Exactly. Yes. And definitely, most importantly, I think it's very important to find a gynecologist or a specialist somebody that specializes in endometriosis, because that was a big part of the issue that I had. I had seen many gynecologists, but their area of expertise wasn't endometriosis, and that is what you do.
This is all I do, basically.
All you do.
Yeah,
and so
all I do.
That's very, very important.
Yeah, just focus on only endometriosis patients.
Yes. And
then improve the surgical skills about how can you take the disease out from inside. It's really complicated.
Exactly.
Complicated, and it needs expertise, surgical skills to remove the disease.
Exactly.
As soon as I remove the disease, the patient's feeling better.
Yes.
So there is a definite payback for the patient.
Yes.
So it's important that, there is always hope within reach.
Yes.
And then an endometriosis specialist just only deal this disease all the time.
Exactly.
All right?
Yes.
Thank you very much for sharing your journey. Appreciate it to coming to
Thank you for having me.
Sharing your journey with my podcast.
Yes. It's always a pleasure.
All right.
To see
Thank you,
you.
Nina.
Thank you
very much for
Dr.
taking your time. Thank you.
Thank you.